So patients come up usually through the elevators here, and they walk in, and then they check in at this check-in desk. And they immediately get triaged into whether they're going to go for clinic or they're going to go to a procedure suite. And then they're asked to wait. And then they put them in the computer as checked in for clinic or for motility or for endoscopy procedures. Then, if they are for clinic, it shows up on the clinic computer. The nurses from here, they're waiting for the patients to have checked in. They come out, they call the patients by name, and then they take them back into the clinic side. They first take them into this, these are 2 intake rooms. They do their vitals, and then they put them in, let's say, any of this room. They turn on the lights here outside to indicate where they are. And then when they are put in the room, that shows up on our computer. So we are all sitting here, and then one of us will go and encounter with the patient. When we're done with the patient, we highlight them. The nurses will then go in, take them out. We have 2 prep rooms for them to prep them for procedures. They prep them there, they walk them out, and then they leave them with these 2 rooms where the 2 schedulers are located. So they go in, they get scheduled for procedures, or if they're just going out for follow-up, they go to the front desk and get follow-up. Once they are done, they just leave. So that is how the clinic works. When it comes to procedure, so it shows up on the procedure unit, the nurse goes out, calls the patient, brings them back into one of the suites, preps them in the room, puts their IV, does their pre-op check. If anesthesia is required, the anesthesiologist goes and checks the patient. When the patient is all ready, the patient is then taken out from this room, goes out into, let's say, into this endo room. Patient has the procedure. After the procedure, patient, the same bed. Patient goes in, comes out to the same bed, goes into one of the, let's say, into this recovery bay. The patient recovers. When we go check out the patient, when the patient is ready to check out with the relative, they walk out and then they leave. Same thing with motility. This is the entire motility space. So we have the largest motility unit in the entire world, let alone this country. We've got 5 rooms for motility. So again, upper, lower motility. The nurses will go pick them up, do the procedure, and then they walk out through there. And if they have to do any follow-up appointments, they'll make it to the front desk and they walk out. So this is the flow as far as the clinic, endo, and the motility unit is concerned. And here are all the faculty offices and admin staff offices. This is the conference room where we have our meetings and lectures and so on and so forth. And right at the end, this is the research space. 80% of it is already constructed, 25% is not done yet. And we have all the labs here, and because I'm currently directing mostly all the research, so I hang out here. I have my own office here too. And this is the empty tenant space for future build. So that's how this whole flow is.